Welcome to another presentation from the CV Academics Foundation, home of the AMP Honors Program.
Hello, AMP Honors Program. Thanks for joining us today. It's Nick Visser coming back again with an interview. Today I'm with Dr. Ben Wojcicki. He's a young professional like a lot of us. Hello, Ben.
Hey, Nick. Thanks for having me.
Of course. I'll start out giving you a brief intro, and then we'll get into questions here. So Ben Wojcicki was born and raised in Wauwatosa, Wisconsin, and pursued his undergraduate and graduate studies at St. Louis University, culminating in a Doctor of Physical Therapy degree in the spring of 2020. Now he is further specializing his career with an orthopedics residency at Nationwide Children's Hospital. On top of all of his accomplishments, I'm very glad to call him my friend, so welcome to the platform, Ben.
Thanks again, Nick. It's a pleasure.
So to start us off, how and when did you become interested in PT?
So my mom is actually a nurse practitioner in Milwaukee. And so for years, talking with her, I knew I wanted to do something in the healthcare profession. And then as I got older in high school, I had a passion for athletics and sports and exercise in general. And so I look at PT as the perfect fusion between healthcare and then exercise and movement. So that's what drew me into the profession.
So for our listeners who maybe aren't as familiar with the field you're describing, can you discuss some of what the job roles in PT are like?
Sure. So I think the first thing that comes to mind is physical therapy with athletics. And that's not just that. You can actually see physical therapists in hospitals, actually in the acute care setting, for example, like in ICUs. You can see physical therapists in nursing homes working with geriatric and older populations. You can also see physical therapists in your typical outpatient setting working with athletes and then non-athletes, people that have just gotten joint replacements or young kids who broke a wrist or a leg getting back to their normal activities. So it's not just what you think of in terms of having the PT on the sidelines for your team. It's more than that. It's really a broad profession.
So with all that variety, what is it that you like? What is your favorite part of PT?
My favorite part is working with the younger population specifically, and then you're looking at your younger athletes. And I think that's such a dynamic population now as more and more kids are getting into sports at such a young age and actually taking on a very high volume of sports throughout the week. And actually, there's a lot of research that looks at specialization, and kids are specializing a lot sooner nowadays, and that's leading to more overuse injuries and surgeries that we've never seen before in such a high amount. And so that's what drew me into this population working with younger athletes.
Absolutely. And I understand that you are pursuing a residency leading you down that path. For most of our listeners, I would think they often hear the term residency in conjunction with medical school. So could you maybe talk about what a residency really is overall and how that fits into your career?
Yes. So residency, as you think of it, is actually, like you said, for medical students. It's required for anybody pursuing an MD or a DO after you complete your 4 years. With PT, it's a little bit different in that it's not mandatory. So it's up to the choice of the students. So to give you an example, it's actually pretty rare. In my class of, let's say, 85 kids, only 3 of us pursued residency. And it's basically a year where you're still a practicing clinician. So I'm still licensed. I still get to see patients and practice, but I get to do so many different things on top of that. Basically, you get to continue your growth. So even though you're leaving school, you still get to practice your skills in terms of labs and lectures. You get to get mentorship from someone that's a seasoned clinician. So basically, even though you're working, you're still learning. And so it's kind of a hybrid between school and full-time clinical care.
And with how few people in your class you said went into it, why did you make that decision and what was that process like?
Sure. That's a great question because it's rare and it's actually growing as we speak. So each year, I think more and more people decide to do residency. So 10 years ago, in terms of physical therapy, there was not many residency programs offered. Now, as we speak here in 2020, there's a lot more and they're still growing. The reason I chose residency was because I knew I wanted to continue to grow as a physical therapist and as a person upon leaving school. I didn't want my my growth to end just because I stopped taking classes. And like I said, residency is a hybrid or a combination of learning in school and then practicing in the clinic. So you get to do both, and you spend more time in the clinic, but you still get to sharpen your skills and learn from people that have been doing it for a long time. You get to work with a lot of different clinicians, so you get to see how so many different people utilize physical therapy in their practice. And so basically, instead of going to a job and only seeing patients for, let's say, 40 hours a week, I wanted to wear different hats. I wanted to do different things, like maybe engage in research or do some mentoring where I would get clinical care and people would tell me what I could work on. So I just didn't want to go down the path of working 40 hours a week in a clinic. I wanted to continue my growth as a professional and as a person.
So you talked about that variety. Could you give us a little window in with a day in the life, or maybe a cut of a few different days, considering all the things you have going on?
Yeah, well, the beauty of residency is that no 2 days are the same. They're always different, ever changing. The four main hats I wear is, the biggest one is as a clinician. So I guess, as I said, I'm still a licensed clinician. I have my certification, my doctorate, so I see patients for the majority of my week. Still, though, that leaves me time for my other three hats. So the one I wear in the mornings a few days a week is as a crutch training and exercise expert at an outpatient surgery center. So before the kids go in for surgery, I go into their room, help them with crutch training. We go and make sure they're comfortable with it, and then I give them some exercises to do after surgery. And then I also am part of a research project. So that's in the works now since I started in August. So as we get going here, our research project will take off and I will be tasked with a big portion of the research. And so each week I spend some time on my own with self-study, looking at research and seeing how we can better fit our project, and actually coming up with my own personal research questions so that I could present someday in terms of this bigger project. And then the last one is mentorship. And so not only do I get to practice in the clinic, but I have someone shadow me once a week for 4 hours. And after that, it's really unique in that I'll see patients for 4 hours and he or she will watch me and give me tips along the way. But after that time, we get to sit down and discuss how it went. So we went how I did well, what can I improve upon, and then going forward, what can I make goals going into next session. And this is more than just looking at like X's and O's of physical therapy. This is customer service, working with patients of different cultures or races. It's much more than just how can you perform as a therapist. It's how can you perform as a person. And so that's the beauty of the mentorship. And so those four pillars make each and every single day so exciting and so dynamic.
One of the other ways I'm aware of PTs continue to augment, develop their career is through a PhD. And you talked about research as part of what you're doing. Could you talk about maybe why you decided to do a residency as opposed to going forward in a PhD, or maybe differences between those?
Yeah, absolutely. So the PhD is designed for research, and it's like your doctorate in philosophy in research. So they actually have physical therapy PhD programs, and you can also get your PhD in exercise science or kinesiology or biomechanics, and then possibly teach physical therapy students. The reason I wanted to do a residency was because I wanted to practice as a clinician. So in terms of residency, a researcher is part of my responsibility, but it's a small portion. The majority of my time is spent in the clinic working with patients and actually doing a lot of the things I spent the past 3 years learning how to do. And as an early professional, I wanted to get the chance to work with patients, to learn from other clinicians, and to do what I've been licensed to do. In terms of a PhD, that usually is someone who is a little bit more experienced, someone outside of school, maybe 3 or 5 years, who maybe was a clinician and has a better knowledge of what they want to study. So going into a PhD, it's beneficial to have some research experience already. And a PhD is almost strictly research and teaching related. So you have minimal time in the clinic. The majority of your time is in research and teaching, and then just exploring that avenue. So possibly in the future one day, but for right now, I love being in the clinic, get my hands dirty working with patients and just enjoying the life of a PT.
So if you don't mind sharing, what is your long-term career goal, would you say? Or what are some of the ways you hope to grow through this experience?
In the short term, this residency will be a year where I continue to grow and get better every single day. And then after that, I would just hope to continue working in a similar setting. So if not at this particular clinic and hospital base, I would love to work with the pediatric population in the setting I'm in right now, orthopedics. In the short term, that's my goal because I love working with these kiddos, and it's a great learning opportunity. Down the line, not really sure yet. I'm a short-term goal person, but I would love to get into academia, possibly teach one day, and as you mentioned, maybe go down the PhD route and look at more research because I miss PT school, believe it or not. I like making an impact on the next generation, and that's why I welcome this opportunity because I think that any time that we can give back to those before us is always a gift. And so possibly one day in the future, but for now, just getting better every single day.
That's great, and we're glad you're starting giving back now by helping us out here on the platform, giving us some of your experience. So thank you very much for all that thorough experience you shared. Lastly, I'm wondering if you have any specific advice for maybe high school or college students that are interested in PT and may want to go down that route.
Sure. So this is the one I thought about before coming on today. What I would say, PT is an excellent career. I know I'm biased as a physical therapist myself, but get immersed in that field if that's what you want to do. So like, for example, I was lucky in that my mom was a nurse practitioner, so she knew of other therapists that I could shadow and talk to. So if you're someone that is interested, reach out, shadow someone that's close to you and see what they do for a day. A lot of therapists would be more than welcome to let you shadow them, and if not shadow at maybe during this time, to just talk via Skype or Zoom or even on the phone about what they do on a daily basis. A lot of PTs you'll find are very much like me, where they want to help, and all healthcare professionals in general, they want to help you guys. So don't be afraid to reach out in any way you can. And then once you find out that's the field for you, go all in. Look at schools, look at making yourself the best candidates to put you in a position to succeed and just to have a great experience in PT school. So that's the advice I have. Don't be afraid to reach out.
Absolutely. Thanks for that. And obviously, AMP Honors members, we have a great opportunity to look down those paths and see the different resources available to you right here on the site. So hope that's useful. Please reach out to me or Dr. Wojcicki with any questions you might have. And looking forward to see you on the platform soon. Thanks.
This has been a presentation of the CV Academics Foundation, home of the AMP Honors Program.